Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about MTHFR and peripheral neuropathy. MTHFR is a newer presentation that people are commonly getting evaluated and saying, okay, you need to get methylated vitamins, and this may be the cause of your peripheral neuropathy, this may be the cause of some of your other problems. So I want to talk a little bit about that and make sure you understand really what the data says, really what the studies are showing, and so forth. MTHFR is a abbreviation for methylene tetrahydrofolate reductase. And its main job is to help in the process of changing homocysteine over to folic acid. So the big presentation with this mutation is really the way that folic acid will be used, a presentation of folic acid and so forth. Kind of an oversimplification, but because of it, because you're getting higher levels of homocysteine, which is an indication of how well the body is using the vitamin B's, it is a lot of times people are saying, okay, you need to get a methylated vitamins to actually get that to work. Now, where this is coming from, methylated folic acid is necessary when you have an MTHFR mutation, or at least one of the forms. There are two different variants of the MTHFR, and everybody has varying amounts. So if you have both MTHFR mutations on both of your DNA strands, then it would be more of a problem than if you only have it on one, and you may have more of the symptoms. Things that can actually happen: you may have cardiovascular and thromboembolic disease, or you may have blood clot problems, or strokes, or embolisms, or heart attacks, depression, anxiety, bipolar disease, schizophrenia. It can lead to colon cancer. It can be acute leukemia. They've shown it to have a presentation with neuropathy, especially diabetic peripheral neuropathy. You can have recurrent miscarriages in women of childbearing age. You can have pregnancies with neural tube defects because of the folic acid deficiency. And so a lot of times people are saying, okay, should we be getting tested for this? Should we be evaluating it, and so forth? Most of the organizations, American College of Obstetrics and Gynecology, the College of American Pathologists, the American College of Medical Genetics, the American Health Association, all do not recommend testing for MTHFR unless you have a high homocysteine level. But you can actually treat for it anyway. So if you're getting high MTHFR mutations, you may have deficiencies in folate, you may have deficiencies in choline, you may have problems with your vitamin B12 and B6 and riboflavin. And as you can see, any of those vitamins, especially the folic acid, B12, B6, will lead to a peripheral neuropathy and some of those kind of problems. So what are some of the things you can do if you know that you have an MTHFR mutation? Stopping smoking is a big one. Getting exercise. So one of the best things you can do for the MTHFR is exercise and eating a healthy, balanced diet. A lot of times you will supplement, or you can add supplements. The big supplementation really that they recommend is just the methylated folic acid. They're not talking about getting all the vitamins methylated. That's not necessary. It's really just the folic acid that should be methylated. And the methylfolate is the big one. There are some things you can do in the diet for MTHFR. That includes eating proteins like cooked beans, peas, and lentils, veggies like spinach, asparagus, lettuce, beets, broccoli, corn, Brussels sprouts, eating fruits like cantaloupe, honeydew, bananas, raspberries, grapefruit, and strawberries, juices like orange and pineapple, grapefruit, tomato. Most of the vegetable juices are very good. Peanut butter is good for this. Sunflower seeds are good for this. So basically, the takeaway here is if you think you might have MTHFR deficiency, you can get it tested, although it's not necessary. You could say, I'm just going to supplement with folic acid, especially if you've tested your folic acid and it's low, or if your homocysteine levels are high. You can supplement with B12, but it doesn't necessarily have to be methylated from what the studies are showing. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 204, MTHFR. So what I'm now telling my patients that might have or think they have the MTHFR is the methylated folic acid as the supplement that should be added, especially if their homocysteines are high. Thank you and have a great rest of your day.